this week's episode of When I Grew Up. On today's episode, I finally am getting to interview a nurse. And the reason I say finally is because some of you have reached out to me wanting to hear what it's like in the day in the life of a nurse and how the process of becoming a nurse and just different types of nursing even. And today I have my friend David Han with me. Hi, David.
Hey, Blair.
How are you doing?
I'm doing pretty good right now. And
Awesome.
you?
Yeah, I'm good too. Just the holidays and stuff. It's been crazy.
I know.
But I hope you had a good Christmas. And by the time this episode's it'll be 2021. So
Yep.
Happy New Year.
Happy New Year to you too. Oh my gosh. It's been a crazy year.
I know, super crazy. Before we get into what you do, David, speaking of a crazy year, I really want to know what it's been like for you working in the medical field in this 2020 pandemic. Yeah, what's the situation for you? And I guess even before all that, could you tell us what kind of nurse you are?
Sure. So I'm a pediatric nurse. And right now I'm in more of a general pediatric setting. Mm-hmm. So it is acute care. And yes, so I work night shift too. But yeah, just kind of going into the whole COVID situation, it's been like a whole roller coaster, right? I think for everybody, not only for healthcare workers, just like the general public too, like every single maybe week or so or month, like things have been changing. Same thing in the hospital. Like we had so many policy changes initially, especially for visitors. Visitors weren't allowed. And it was especially tough in a pediatric setting because, for kids, parents need to be there. And so there were a first exception for kids. And so one parent was allowed at the bedside, but they couldn't leave technically the hospital, And so that's also very tiring for the parent to be at the hospital at the bedside 24 hours a day. But generally, as time went on, things kind of began to change a little bit and they were more flexible with that. But so I totally felt for the patients who were older who couldn't have any visitors by their bedside, especially during that difficult time. And since right now I'm working in pediatrics, I feel like typically in pediatrics we don't see as many cases as adults. I feel like for the adult hospital world, they're getting really impacted with COVID cases left and right. I know right now, currently at my workplace, I hear that they're pretty much packed. And so in California, when they feel like they're estimating that all the ICU beds are going to be pretty much at capacity, they enforce curfew and encourage people not to go out and all these things. So that's what's going on right now in California, but they're still seeing back-to-back cases daily. So
that's crazy.
That's been a little bit tough. Yeah. But how we're doing it at my workplace so far is typically in the ER where I work, everyone will get a COVID test no matter what. And either they wait for the COVID test there in the ED, but typically they're so busy. In our children's hospital, we have we call it a COVID landing unit. And so typically all the patients will go there until the results come back, whether they're positive or negative. If they're positive and they're really sick, then of course they'll go to the ICU. They have a designated floor, especially just for COVID positive patients. And if they're sick but not critical, they need critical care, then they'll go to a specific unit that will accommodate having those COVID positive patients. But what's really funny is, and what I've heard from other nurses who've been working at that landing unit, a lot of patients came in for different complaints, but ended up being positive for COVID at the same time. So it's very interesting to see. And so
crazy.
Yeah, I feel like everyone's been learning left and right, and it's being very flexible. So yeah, crazy year.
So interesting. So right now, I know you said that there's curfews in place right now in the state of California. But with that, has there been an increase? You said not in the pediatric unit, but at your hospital, have you guys seen an increase in cases? Just out of curiosity.
From what I've been hearing, because I talked to different nurses and even some nursing supervisors, they say they're still getting a good amount of cases.
That's so crazy.
Daily. And so, yeah, it's just crazy how much it spreads, and so this like continuing education, encouraging people to wear masks, wash
Mm-hmm.
their hands really well, be extra careful. But yeah, it's been spreading a lot.
Yeah. I mean,
And I'm
when
sure
you're,
over there too.
yes. I mean, like, thankfully, by God's grace, I don't have anyone that directly has been affected. Just I've heard here and there, just distant people. But yeah, I mean, things are really crazy here as well in Georgia. But you were mentioning too, like just the policies about one parent being there with the kid. I mean, I almost started crying because because like, I just can't imagine, being
Oh
the
yeah,
parent. The kid is just sick. They don't really know what's going on, I feel like, depending how old they are, I guess. But just like so many concerns running through one parent's head and having to be there 24/7, like you mentioned, is just,
absolutely.
I'm sure. Like, I mean, so as a nurse, um, with those kinds of situations, um, like, what is your capacity to be there for the parent? Like, I mean, do you feel obligated to be there for the parent emotionally as a nurse, not just for the child as well?
I mean, absolutely. Um, you know, but at the same time, I feel like for nurses, we're always assessing the situation, assessing that the children's needs and then also the parents' needs. So definitely they need like emotional support. I mean, we're there for them when we can, when we have the time.
Mm,
But I feel like for some certain parents at the same time, they're so overwhelmed, they
sure.
kind of need their space, and so you definitely treat the child, try to be extra cautious of like, not providing overstimulation because they're already stressed
Mm,
as it. They're
interesting.
stressed as they are, and kind of give them some time to rest. But luckily, so far over here, they changed the policy to two caregivers at the bedside, and they can leave in and out, but just they have to get screened every single time they come in. So
That's great. That's awesome that they've changed that policy.
yeah.
Hey, so what came to mind as we were talking just now
Hmm.
is like, like nurses and like bedside manner.
Hmm.
Like, is that a skill that one picks up as they like get more experience as a nurse? Or like what was that like for you in the very beginning of your nursing career?
Oh man, it was kind of nerve wracking. So in my nursing career, I felt like it was better. But then initially in nursing school, you have clinicals,
Mm-hmm, mm-hmm.
and so I remember my first clinical day. I walked in and I said, "Hey, my name is David. I'm going to be your student nurse today."
Uh-huh.
And this patient had a pretty extensive history, and like after knowing that, I can totally feel for him. But the first thing he said was, "I don't give a bleep. Get the bleep out of my room." I'm like,
Okay.
and so, but and now that kind of took me by surprise at first, right? It's my
Sure.
first day at clinicals. I'm ready to get in this, and then that's the response I get. But then I think just like just being you,
Yeah.
uh, understanding that people, especially people who are ill,
Mm.
are going through such a tough time, and for this patient especially, like oh my gosh, like I felt for him so bad. Like
Mm.
he had an illness, and due to that, they gave him medications. And he ended up going through like a withdrawal, and
No.
was so sensitive to sounds and all these
Oh
like
my goodness.
had like very loud sounds, and because of that, he ended up losing his job and everything else. His life kind of crumbled down. So definitely understandable.
Yeah,
But
I mean,
also, yeah, go ahead.
oh no, I was just gonna say, like, I mean, yeah, you guys are seeing people literally at their worst, like at their weakest, and I can't imagine, like, what is that like? I don't even really know what I'm asking you, but yeah, what is it like, that part of being a nurse? Not just the technical side of it, but just emotionally too, like, dealing with all types of people, right? And especially
Mm.
at they're sick. That's why they're there. Um, how do you cope with that, and how do you like navigate through that as you're like, you know, trying to put in IVs and like give them administer medicine and stuff like that?
Right. I feel like everyone's different. Everyone has their own way of coping. Everyone has their own way of like just getting through things.
Mm-hmm.
But and everyone also has a reason why they started this profession in the first place.
Sure.
And so I feel like for me personally, like to be in this position is an honor for me personally. And so seeing someone at their worst or seeing an ill child is something that I want to help them to overcome, you
Mm,
know. And I think the beauty of pediatrics is you're treating the pediatric patient as well as their family and their parent, you know. A lot of times, like I feel like when someone, like let's say the parent is really stressed out, that kind of vibe kind of rolls off in their child, you know, or the child is super stressed at the same time, parents aren't coping well, and it kind of rolls, they start to get super stressed out too. And so in that, um, I guess in the opportunity that you have, you know, you can do really some education, you know, like, hey, so this is what I'm doing right now. Sometimes they don't understand why we're doing certain things and kind of explaining this is why it's beneficial to them. These are some things that to look out for, you know. And so in the back of their mind, like, oh, okay, you know, like they have more peace of mind. You know, they don't see someone just like putting an IV for no reason, you know, like, you know, or giving them a shot or whatever it may be, but they're now they kind of have an idea of, oh, okay, this is why it's beneficial for my child, you know.
I see. I see.
So
Okay, that makes sense. Okay, well, sorry, I got into a whole like different thing than what I wanted to ask you originally, but yeah. So like, what is a typical day for you? You mentioned earlier that you do work nights, and I know. Oh my goodness, I should mention you've been working like 10 nights in a row before having
yeah,
this interview. But yeah, what is a typical shift look like for you?
it's funny because I feel like there's no like such thing as a typical shift
Okay,
actually, but because
right.
every day is so different, you know.
Yeah.
um, you can have the same set of patients, they're totally fine one day, the next day one of them crashes, you know. But generally what we'll do is when we walk in, so our shift for me starts at 7 o'clock and it goes until PM and it goes until 7:30 in the morning. And
Mm,
so typically when we walk in at 7, we have a little huddle with all the other nurses. The off-coming charge nurse will kind of go over our census, so how many patients we have, what are some warm spots, like patients who I'm kind of like quote unquote watchers, you know, to look out for them, especially because they feel like they might start to go downhill,
mhm.
and kind of get like a general like sense of how like the unit is going. After that, you'll see your assignment, so you'll get a handoff, so you get a report from the off-going nurse, and that's an awesome time because they're going over why each patient is here, what's their history, based on their shift, like what was their assessment, you know, like if they're coming in for asthma, you know, how is their reading, how is their airway, you know, and vice versa. You guys will go over your medications, your lab results. And so a good like 30 minutes of your first from 7 o'clock in the morning, I mean, sorry, PM till 7:30. So
PM.
7 p.m. to 7:30 p.m. is
Yes.
quote unquote our report time.
Okay.
And so
Okay.
we like to have it as much as we can, like not distracted, so we can kind of focus on, you know, why each patient is here, what are their needs, what are some concerns that were brought up or the previous nurse noticed.
Mhm, mhm.
And from there, I'll kind of look at my orders, the orders that the doctor ordered for the specific patient, you know, what are some lab results, you know, because a lot of times we like to kind of trend lab results too. And so sometimes if you see a lab result in the morning and it might look normal, but if you look at for the past week, you can kind of see a trend. Oh, is something trending abnormally higher or abnormally lower? So you can kind of
Mm,
catch that before. And then all from there is it's kind of like different every single day. So I'll tend to see my first patient that I see is the one I feel like um, is highest priority for me. You
I
know,
see.
either they when I was getting a report, they seemed the sickest, or I felt like I want to see this one first because I was most concerned about X, Y, and Z, and we'll kind of see each patient accordingly.
Okay.
And then we like to kind of cluster our care. So if they have medications at that time, you'll do your medications, you'll assess them. So you take a listen to their lungs, their heart. You do all your assessments. You'll give whatever medications you need. You'll give some education, introduce yourself, do your vitals, and then kind of move on.
Mm,
And then
okay.
from there, everything is different because sometimes they have different medications or a concern comes up, and so now we're kind of seeing someone else first, and so it's like all over the place from there.
That's crazy. Okay. What's crazy to me is like um, I there's a lot of you have to be a good multitasker. It sounds like. or it's advantageous for you to be a good multitasker as a
I think
nurse.
so.
Sounds like, because I'm like, wow, there's a lot of things you have to juggle on top of, like, you're not just taking care of one patient. It's several patients that you have to keep charge of and keep a lookout for. And it seems as though if something were to like be misplaced or or like you miss something, it is extremely critical to the patient that you're taking care of. So I feel like, yes, it would be advantageous to be a good multitasker as a nurse.
I agree.
Okay, so I mean, David, how long have you been out of nursing school, and are you a registered nurse?
I am some
Okay.
registered nurse.
Okay, so I'm sure we'll get into all of that and how that works, but how long have you like actually been officially out of nursing school and doing nursing?
So I started my first job in 2015. So it's been a little over 5 years now.
Oh, okay, okay.
Yeah.
Um, well, then take us back to the beginning. Like, why did you want to become a nurse? Like,
Yeah.
yeah.
That's a great question. I feel like that's like every interview. That's a question that most nurses get.
Yeah.
But yeah, great question. In the beginning, it was I didn't first choose to be a nurse in the beginning. When I was younger, I really liked doing a lot of things, and in my mind, I envisioned myself wanting to do different careers. Um, but it was in my high school time. I want to say my sophomore or junior year when I decided to become a nurse.
Mm.
And it was kind of like my whole life story. Like in the beginning of high school, um, I felt like with the crowd that I was in, I didn't make the best choices. Um, I did many things that I shouldn't have done. Um, and during that time, because I grew up in a Christian household, my grandpa was a pastor. But for most of my adolescent life and everything before that, I felt like I didn't really truly know God too much. Um, and so I remember my dad always telling me, like the most important thing that I want you to do when you find a job is number one, like love it, and also like you'll know when you found it because it doesn't feel like you're working anymore. And so like that I always thought about for a while. And there was a point in time when like I met Christ, and so during that time, like I wanted to do something because back in the days I had a lot of pride issues. So I wanted to do something that I knew that would really just like no pride, no kind of thing. And during that time, like I didn't know of that many male nurses. I loved helping people. Like I was interested in the human body and like science. And so naturally I felt like, okay, I think nursing is the way to go, you know, because I was afraid of during the time, okay, like what are they gonna think of me, if you're a male nurse, they might say this or that, but and then like whatever, like I just want to help people without getting any like praise or anything, but just for the fact of helping someone, and
Interesting.
yeah, and to
Can
do
I
it for
just
God's
interrupt you
glory,
real
yeah,
quick?
yeah.
So like, just on that topic of how you said that you struggled with pride, which I still do to this day. But and you chose this profession partly because you felt like it would be a career that there wouldn't be any accolade or praise for helping somebody. And I mean, was part of it too, like, I guess what I'm really asking is like, if you were a doctor, there would be praise, like, if we're honest, right? Like, oh, like, and even within your family, maybe like, oh yeah, I mean, like, there's this Asian American kind of thing where a lot of even Korean Americans, right? It's like, oh, you should be a doctor, you should be a lawyer. That's why I'm doing this podcast, right? Because there are other options, out there.
Yeah,
But
yeah.
did was that like, did that run through your mind too? Is like, nursing is something you felt like was like kind of a humble position? Is that what you're getting at?
Yeah, pretty
Okay.
much. Because I
Okay.
felt like, if like I thought about like before becoming a nurse, I was actually interested in dentistry because I like doing hands-on stuff and
Okay.
everything.
Yes.
But I feel like, dentist, doctor, like people associate you with, oh, he's a doctor, like,
Right.
and then automatically, like, the way they treat you can be different,
It is.
And during that time, and I think now, like, nurses for sure, like, our profession has, like, shifted a lot, and people
Definitely,
would totally
definitely.
respect nurses so much more. But during my time, I didn't know too much about nursing, um, to the whole capacity that it actually is, and I feel like it wasn't as like nurses weren't as appreciated
Right.
then as we are now.
No, and I don't disagree with that. And I even feel like maybe even when you became a nurse or were studying to be a nurse, is kind of, I remember there was a time where it was like there was a need for nurses, like more nurses, and so like there were, I remember, yeah, there was like kind of more talk around it, like because there's like there was a need for nurses, so pay was like increasing and things like that. And but now, I feel like with even with like social media and things like that too, and the and the pandemic that we're in, like and my me myself, as somebody that had two babies, like I'm thankful for nurses. I'm it's a thankless job, the things that you guys have to do. If I'm honest, and but anyways, okay. So you decided to be a nurse, and that was the direction you were going. You said your junior year of high school?
I think like sophomore, junior year-ish,
That's
around that.
early though, David. How did you know anybody that was a nurse?
I did not.
That's so interesting to me that you were like, this is I mean, was it a God thing? Was God like, this
In the
is maybe,
beginning,
yeah?
I don't think so too much. I just feel
Okay.
like that's something that I feel like I can do, um, to glorify God,
Mm,
because it's like killing the things that like I know I'm struggling with, and to do it for a different purpose. But as I kind of progressed into nursing school, like that was all Him.
yeah.
Like honestly, like
Yeah.
um, when I applied to nursing school, I actually only applied to one school,
Oh,
and so
wow.
and I do you want me to go over like the whole process of nursing school first,
Yes,
or
please, please.
yeah? So generally, for most schools, for actually, let me see. Okay, for most schools, you need to do your pre-nursing major first. So it's
Okay.
essentially your prerequisites. Um, but there's different schools have different programs. So there's certain schools who have like once you start your freshman year of college, you're actually admitted into you're already in the nursing program.
Mm.
But for my school, it wasn't. So I went to State University as a freshman as a pre-nursing major, and I had to reapply for the nursing program at the same school.
I see. Okay.
Yeah.
And
So
at
that
what
yeah.
year do you do that?
So it's whenever you finish your prerequisites. So it
Okay.
can be 2 years or 2.5 years. So kind of depending on everyone's a little bit different, but generally around 2 years.
Do you
Yeah.
happen to know, like, I know some people that like get their bachelor's first and then they decide to be a nurse.
Yeah.
Is that program different, or do you happen to know
So,
that?
yeah, that program is a little different because the people who had a previous bachelor major
Uh-huh.
and wants to go become a nurse, they can become a nurse through an MSN route, which is a
Okay.
Master's of Science in Nursing.
I
And so
see.
now that yeah, so
Okay.
now you're RN, but you hold a master's degree in
Oh, wow,
yeah in
interesting.
science and
Okay.
everything. Yeah,
Okay. Is there any
yeah.
advantage to that or disadvantage? It's the same?
I think generally I think it's the same. Don't quote me on this.
No, no,
But
I
I
won't.
think for I think for the MSNs or the RNs who have the masters in nursing, they can actually qualify for like nurse leaders. I think
Oh,
I think something is a little bit different.
okay.
So
But
like
that
if you
kind of
want
makes
to,
sense in my head.
yeah.
Yeah, okay.
But then again, I'm not too sure about that.
Okay.
So
Don't
you have to
worry.
look it up.
Don't worry. Everyone, it's not set in stone what he just
Yes.
said. But yeah, okay. So you applied to nursing school again
Yep.
mid after you finished your prerequisites.
Yep.
And how now are you supposed to, at your school specifically, do you finish in 4 years just like you would an undergrad degree, or is that longer?
Yeah, so for my school, since your first 2 years of pre-nursing counts towards your bachelor, and then nursing school itself is usually around 2 years.
Okay,
But for
okay.
my school, it was 2.5 years.
Oh, okay.
And
Why is
yeah,
that?
I think just because we were a quarter system,
Oh,
and just the
okay.
way they kind of had their classes, it ran a little bit longer, and so
Gotcha.
yeah, ours essentially a 4.5 year program.
Okay, so
Yeah.
you finish your prerequisites, you get into the nursing program.
hmm
Like, do they just throw you in, or what's it like? What happens that first year of nursing
Yeah.
school?
So the first year of nursing, you're taking a good amount of classes. So your prerequisites, you already took your anatomy and physiology, basic bio. Now you're kind of going to more of your major specific classes. So you're like in nursing theory. So
Mm,
kind of knowing like the history of that's like different philosophies. You're getting to know like your pathophysiology, your more of your science courses.
mhm.
Towards your major, you're taking your skills class, so you're starting to learn how to perform skills properly, as well as starting clinicals and a bunch of other things like subspecialties and things like that.
Okay, okay. Um, and then when do you like start going to see patients?
Yeah, so I think every school is different.
Okay.
For us, I think we started seeing patients, if I remember correctly, in our second quarter of nursing school.
Oh, that's fast. No?
I think it's
Fast.
okay.
Well, I guess there's only 2 years, so it's not
Yes.
that fast. Okay, so, um, and then when you start seeing patients, like, okay,
Mhm.
so for me, like, this is what I imagined in my head, right? It's
Yeah,
like
yeah.
you're going to see patients, and then, like, I mean, I just can't even wrap my head around learning to, like, put a needle into somebody's arm, but you have to do it. So, like, what happens? Like is there like some practice rounds, or what do you do? How do they
Yeah.
train you?
Yeah, so we get trained in those skills. We have classrooms specific for that.
Okay.
And so naturally, until you're checked off on a skill, you can't. Let's say I didn't learn how to do IVs yet.
Uh-huh.
I'm not allowed to do IVs in my clinical
Okay.
setting.
Okay.
And I think usually when like our school has like it's not a policy, um, but essentially whatever place we're going to for our clinicals, like they have a contract with each other,
Uh-huh.
and
Uh-huh.
things that nursing students can do and things that nursing students cannot do, kind of thing.
Okay.
Yeah,
Okay.
and generally whenever you're passing out medications or doing any kind of skill that requires supervision, like your nursing professor has to be there with you
I see.
as like a safety check, you know.
Okay. Man. Okay, so like did anything like that like scare you? Like, putting needles in or anything like that, or even just like I don't know, the real stuff, like helping people go to the bathroom. Like, did any of that intimidate you
Actually, not too much.
personally? Okay.
I like doing skills personally,
Okay. Okay.
but
Okay.
when it comes to like helping people up, like cleaning them and changing them, like
Uh-huh.
I don't think it bothered me too much at all.
Man, you were
Like
already all in though, right? Like you're
yeah,
like, I'm gonna
I
do
think
this.
so. hmm
That's pretty awesome. Okay. So was nursing school challenging for you at all, or were there any obstacles that you felt like you faced during those last 2 years?
Yeah, I would say it was pretty challenging.
Like academically, or how so?
Like it was very like tiring and like taxing. Like and so because we were a quarter system essentially, so you're finishing whatever class in 10 weeks. Um, and
That's
so
short.
yeah, so you're finishing essentially a whole book in 10 weeks. Um, and so we kind of learn to, and I think for most nursing schools, you learn that whatever nursing class you're in, like you guys kind of become a community and like a
Mm,
family. And so like people, like certain people, like your friends will like write notes for different chapters, and you guys kind of come back and share it together, like have study groups. The thing that was tiring about it was because like we were taking so many classes already,
mm,
and then when we start clinicals, what we have to do is we need to do something called a care plan. And so how our school did it was they would assign us to go to the hospital the day before we started clinicals.
mhm.
So if I had to go to clinicals on Tuesday, on Monday, sometime in Monday, usually around the afternoon or nighttime, you have to go to the hospital. And then either the professor or the charge nurse at the time will assign you a patient. And so you will go on their medical records, making sure that all their privacy data is kept private, but you will write like, hey, what did they come in here for? What is their history? All their medications. And then you go back home and then you basically make a whole template for this patient. So how they taught nursing students was like, let's say if they came in for pneumonia, you kind of write, okay, like their history, their primary diagnosis, and then like you have to explain that disease process, so you're proving to the professor, hey, like I know why they're in here for, and I understand what's going on. For all the medications, you have to write, why they're taking it, like the side effects, like the important ones to look out for, and then you're coming up with a care plan for them.
Okay.
And so sometimes, like honestly, for us, for our school, some of them was like 10 to like 15 pages. Like it was like super long, and you're doing that the night before. So you have your classes that you attend the day before. You go to the hospital and you come back home. You prepare all this stuff up, and sometimes you're sleeping at like 1 or 2 in the morning, and then you have to be at the hospital at 6 in the morning, and then like take care of the patients, and then start your class again. So like the repetition of that was kind of like a little tiring. And then when we started going to our specialty classes, so we had 2 specialties in our quarter. And so essentially it's like pediatrics and let's say perioperative, which is like OR. Like each of those specialties are done in 5 weeks. And so in 2 weeks you have a midterm, the 4th, 5th week you have a final, and so everything's condensed in those 5 weeks. And so
holy smokes.
Yeah. So it was very fast paced, kind of tiring having to do everything such late at night and studying and everything. But take it day by day.
Right.
You'll get through it. Yeah.
Yes. That's good advice. Just to clarify, those care plans though, like that's only something that the nursing students do, right? Like nurses don't do that, right?
Actually, nurses do that, but in nurse for us it's a little bit different. So for the nursing student one, they want you to explain every single thing. As you're doing the care plan, but essentially the whole care plan is a specific basic way of like intervening for the patient and assessing them, and try to meet certain goals. But we do that for nurses, we do that, but we do it on the computer. It's not as long.
Okay.
But it's like you're typing a plan for them, or like are they meeting this goal kind of thing and stuff like that. So
and you're not getting graded on it, I guess. So
no.
It doesn't have to be extensive and stuff. But okay. Yeah. Okay, makes sense. Just out of curiosity, do they teach nurses like how different medications like interact and stuff too? Okay,
yeah.
So like, are you responsible to kind of know, like, have some sort of knowledge about those types of things as well?
Yeah. So we take a class called pharmacology, and then so if we think about like the pathway of an order being put in, and let's say a doctor putting in an order and the patient receiving a medication, it kind of goes to it goes to different people. So the doctor who's putting it in, the right dose, the right route, and then after that, it goes to pharmacy, and the pharmacy has to verify that this medication is correct. They prepare it, and then the nurse gets it. And so they go through so many different people. Sometimes mistakes can happen, right? So definitely the nurse has to know, like, why is this patient receiving this medication? They need to know if there is any contraindications for the patient to get it. Is there any interactions with different medications that they're taking? So you either have to space it out, or you can't give it together. And then you also have to look know what to look out for, in terms of complications or adverse reactions. But at the same time, let's say by chance, whether the doctor instead of putting milligrams, they put grams by whatever, when they were so busy they didn't notice. And then pharmacy was also super busy, they didn't notice. And the nurse gets it, they don't notice it, and they give it to the patient. It's going to be our fault because we were the last person to actually give it to them.
I see.
And so because it's going through so many people, when we're reviewing our medications, and especially when a lot of kids a lot of patients have a lot of medications, you need to know, okay, like what's the right route. Like we look at different like rights of medications to administration that we have to go over
Yes.
before we give it to make sure that they're
Okay.
safe, you're getting the right one through the right way, and et cetera, et cetera.
Man,
A lot of
that's
a
kind
lot
of
of liability.
scary. Yeah, that's really kind of scary if I think about it. Like, I mean, just in general, not just nurses, but like I always think now that I'm older and I also have my own kids, I always think like, I'm taking them to the doctor, but they're just making an educated guess, really. Like based off what their knowledge and stuff, and it's like, like they're human too. People make mistakes, and like, um, yeah, I'm sure there's a lot of liability, huh? And especially I mean, do you and then you're dealing with kids, you personally, with pediatric patients too. There's even more, I'm sure, liability in that, and um, yeah, it's kind of crazy. But and I also watch a lot of medical shows. I shouldn't do that. Like I just make up scenarios about how hospitals work. But anyways, well, okay. So going back to your schooling, after you
Yeah.
graduate nursing school,
Hmm.
I'd imagine there's some sort of test you'd have to take, right?
Yes. Hmm.
What is that called, that test?
It's called the NCLEX.
NCLEX. Do you know what
Yeah,
that stands for?
I do not off the top
Okay.
of my head.
It's not important. It's not. It's just the test you have to take.
Yep.
So, um, is this like just a cumulative test of everything like that you've learned, or
Yeah.
there are different sections? How does it work?
Yeah, it's essentially cumulative of everything that you learn. So
Okay.
the test that you have to pass is basically, if you pass it, you're saying that, oh, this person is competent to take care, after they're graduating high school, oh my gosh, nursing school, to start taking care of patients.
Okay.
But the NCLEX is super different from like regular tests. It's not like, you have to get 60% to pass.
Uh-huh.
So it's like, I think the minimal questions that you have is 75, and then the most questions you can take is 200 something. And so how it works is you'll get a question. If you get that right, the question gets a little bit harder. And then if you get that right, it gets a little bit harder. If you get that question wrong, your score kind of goes down. And so there's like, let's say if you're looking at a graph,
Uh-huh.
your end score has to be like above the passing line.
I see.
Yeah. So
Okay.
so the computer will analyze like your scores. If you're like kind of going back and forth a little bit, you might be taking more questions. But if you're consistently getting it a lot right, then you'll stop at the minimum 75. So it's very different from like
That's
regular tests that you might take.
so fascinating to me. I
Yeah,
don't know
super
why.
interesting, right? Yeah.
Okay. So, like, I guess one might panic if they're getting a lot of questions. No?
I feel like you can panic, right?
Yeah,
So
right? Like, because it's like, why am I getting so many questions? Okay. And so, but it's taken on a computer, I guess these days.
Yep.
Everything's taken on a computer. Okay. Okay. So, is there a limit to how many times you can take this test, or no? Do you
I
know?
don't think there's any limit. I think.
Okay.
I think you can keep on taking it.
Okay, cool. And then after that, you start working.
Mhm.
How is it competitive to find a job, or do you know?
I think it's pretty competitive,
Yeah. I guess
especially.
especially if there's a hospital you want to work at, right?
Yeah, and during my time,
Uh-huh.
hospitals like they have like residency programs. So
Oh.
essentially, like they're kind of training you. So you have like a preceptor that you're working with to kind of like hone in your skills and to kind of like guide you to becoming like more comfortable and
Mm,
competent.
okay.
And so before they didn't have that many programs like that because like I think like the money issues and everything.
Sure.
But the year I graduated, actually, fortunately, they started having more of those. So a lot of hospitals were like starting to realize, okay, it's actually really important to have like to train nurses, and to get them in. And so more and more started opening up. But
Awesome.
for like specialties like pediatrics, it was definitely more competitive.
So,
Yeah.
was it a matter of like, you like working there before? Like, did you do any externships or,
I didn't. I don't think there was like no externships available. The only thing the
Oh.
closest thing that I can think of that you had was your preceptorship, which was like the last stage of your nursing school.
Uh-huh.
And it's kind of like clinicals, but now it's like your capstone. And so
Okay.
you're assigned to a specific unit, you know, and then you're working with a nurse, kind of like the residency program, but you'll start off with one patient, but you're learning to do everything, like taking on the roles as an RN
Uh-huh.
with the
Uh-huh.
guidance of a nurse being there too. So
Okay,
you'll start
so
with one. Go ahead.
no, go ahead. Go ahead. Keep
Yeah.
continue. Uh-huh.
Yeah. So every preceptor is different. Some preceptors will have you start with one patient. Once they feel comfortable, you'll take on two, and then you'll take on like the whole assignment, and like vice versa. So
I see.
yeah,
Okay, so is the reason did you start off in pediatrics?
I did not actually. Great
Oh,
question. Uh-huh.
where did you start?
I started with adults actually.
Oh, okay.
Yeah.
In what the capacity with adults?
I was working on a medical surgical floor for
Oh,
adults.
so like is that like
Yeah.
post operations or
No, not post-operative, but it's like medical surgical is like it's a specialty called so it's essentially as a specialty.
uh-huh.
So where you have like patients either from that are more medical like diabetes to surgical, and so every unit's kind of different. Yeah, so our unit was mainly like neuro vascular, like your blood vessels, your kidneys, your heart. And so we had a lot of stroke patients, patients
Mm,
with like different various heart conditions,
mm.
and things like that. So it was a good learning experience and very fast paced. So it was good.
And how long were you there before you went to a different department?
I was actually there for a year,
Uh-huh.
and so like the whole story goes after I graduated nursing school,
Uh-huh.
like people are like you're applying for different jobs left and right, but still like in the place that I lived, there was only so many available options. A lot of people were like moving out of state, you know, but taking jobs there, getting experience coming back. So originally I was going for pediatrics, but then honestly, when I was in nursing school, a lot of the specialties that we took were really interesting to me.
Mm-hmm.
And so I ended up taking adult care first. Um, Definitely was really grateful for that because I learned a lot. Um, During that time, I did my senior capstone at a children's hospital that I'm currently working in.
Oh.
And so a lot of the nurses were reaching out to me like, hey, you know, David, like um, just after a year of experience, you get to reapply, you know. And so after a year, I ended up reapplying, got in, and then just stepped in the door that way.
Oh,
So
nice. That's so and you've been there ever since?
I've been here ever since. Yeah,
So you had mentioned it earlier, kind of how you liked kind of serving the entire part of pediatrics is you liked helping the entire family like as a whole. Is that one of the main reasons you stepped into pediatrics? Were there any other reasons you decided you wanted to work with children?
yeah. I mean, I loved working with kids in the beginning. I
Oh,
find
okay.
myself like as a kid at heart too. You know,
Mm-hmm.
um, yeah, and this like like when I was in high school, like I taught kids as well. I was a part of a ministry called God's Image, where we kind of taught like singing and dancing to kids, but to do it like to glorify God, you know. Um, and so like I don't know, working with kids is such an awesome thing to do. You know, I love it. And I think the thing that was more important than that for me was like the whole family thing,
Mm-hmm.
you know, like definitely because if you're just treating one person it's one thing, but having opportunity to treat both the child and the family, you know, meant a lot to me. And so
Yeah, that's awesome. Just shameless plug, you guys. Go Google God's image, SoCal and NorCal, because they're really awesome and they're such a blessing. Do you still teach?
not anymore
Oh
actually.
no,
Yeah,
I didn't know that. I don't know
yeah.
why I thought you did.
It
It's a really great ministry, you guys. They're
is.
so gifted and using their talents for to build God's kingdom, and I love it. I maybe one day Atlanta will have a team, but
Oh yeah.
um, but to get back to what we were talking about, Yeah, so that's really cool that you're still there in pediatrics and doing that. But I guess I'm confused a little bit. I so when you graduate and take that test and now you're a nurse, like is that are you an RN or is there a different test you have to take?
Yeah, so you're an RN.
Okay, so that's
Mm-hmm.
it.
Mm-hmm.
Okay, okay. So all the nurses that I know are RNs then.
So like, I think it kind of depends on which like what you're talking about with nurses.
Okay.
So if you're talking about like nurses that are at the bedside giving medications, like
Uh-huh, uh-huh,
assessing you,
uh-huh.
and providing teaching, those primarily are more RNs.
RNs. Okay.
Um, but then you have like in your RN field, you have like different degrees, right? Like you have your BSN degree, which is your bachelor's, your
Uh-huh.
ADN, which is your associate's degree nurses, and you have your CNAs, which is like your nursing assistants.
Oh,
Yeah.
okay.
So mhm.
And so, um, what's the differences between those three?
Yeah. So the best definition for those three is like if you look at your local state
Uh-huh.
and you kind of see that their practice acts,
Uh-huh.
it'll definitely
I
specify
see.
for this state for this job, like this is what you're allowed to do, kind of thing.
Okay.
But essentially, the RNs with with your bachelor's degree are the ones who can administer medications, provide teaching, follow up, delegate tasks to other people. Your ADNs, I believe, can do that. I think the only thing that they can't do is, don't quote me, I think is to provide teaching, if I'm not correct,
Okay.
if I'm not mistaken. And then your CNAs are, they can take vitals. You can assign them to do tasks for a stable patient,
Mm-hmm.
as long as you know that they're able to do it and they
Mm-hmm.
can follow up with you.
I see. Okay.
Hmm.
Now my next question, and I don't know, you probably know the answer, but it's okay if you don't. So a term that I've been hearing a lot is NP, like nurse practitioner.
Yeah.
Now, what is that?
Yeah. So a nurse practitioner is essentially an advanced practice provider.
Okay.
So you're you're not only not so you're not a registered nurse anymore. You're practicing at a different kind of like level, I would say. So essentially, like you're the ones like almost like what a doctor would do, but definitely with more limitations. You have to work with a doctor. You can assess them. You can prescribe medications. Um, I believe you can order tests for them,
Mm,
but there's specific things that they cannot do at the capacity of a doctor, but still kind of like work um, similarly, have like the similar responsibilities as them, I believe. Yeah.
okay. So, like, why would one be a nurse practitioner? Like, I mean, just full disclosure and being completely candid, like, is it more money? Was that a reason? Or I guess everyone's different, but I guess
Yeah.
I'm just curious to like, I mean, it's just more studying too, right?
Hmm.
Okay. So it's just in between a RN and a doctor.
I think the easiest way, yeah, and that's the easiest way to explain that
Okay, okay.
with limitations, but you're
Okay,
able
wait,
to do
yes.
more than RN will be able to do. Yeah.
Okay, okay. Interesting. I've just been hearing, like, even at my gynecologist, sorry, it's the
Yeah.
only doctor I really see. That's why I bring it up. But,
Uh-huh.
like, yeah, they'll ask me, like, do you want to see a nurse practitioner over, like, are you okay with seeing a nurse practitioner? And I'm
Yeah,
like,
yeah.
I guess. Like, I don't, I don't know. But I guess now I know it's just, they're essentially doing the same duties as a doctor with the limitations that you talked about.
Yeah.
Okay. Interesting. Nice. Do you have any ambition to be a nurse practitioner at some point in your career?
At one point I was thinking
Oh,
about becoming a pediatric nurse practitioner, but right now, right now I'm loving what I do.
yeah,
I like being at the bedside.
yeah,
But maybe one day, and when God says, go ahead and go for it, then
yeah.
I'll go and do it.
Oh, I guess okay. So the nurse practitioner wouldn't be at the bedside like the RNs are then.
Mm-hmm.
Okay. I mean, yeah. I mean, that's. That's a calling in itself, being able to
Yeah.
interact with the patient like that at that capacity. So it's definitely a different job, huh?
Mm-hmm.
Okay, I see. It's starting to like click in my head.
Yeah.
Okay, well, I feel, was there anything else that I missed that we didn't talk about that you maybe were hoping to talk about or tell people about?
I think one common question that a lot of people ask is, what's the hardest thing about becoming a nurse or
Yes.
as a nurse? And then again, like everyone has different like answers. But I think number one is um, like staff burnout. There's a lot of things that kind of burn you out. Whether it's like dealing with patient death or or like just being so tired. Like having a like not healthy work life balance. And so that's one thing to kind of like think about.
Yeah.
But definitely, that everyone has their own coping mechanisms too. So,
Mm. How do you deal with that?
oh man, so that's a tough question. So I totally thought I was okay with it.
Mm.
Um, I like when I worked in the adult world, like I've seen like patients die. Either they were on comfort care, you know, or it was expected, and whatever it may be. Um, but there was a time, actually, like just past this past year, I was working in a cardiovascular intensive care unit,
Mm.
um, and I was the patient. I was with the patient. I was with. I had two patients, so that's usually in California like the max that you can have. Um, One of my patients, they found out that he had something, um, a clot that was going to his lung, and so they separated my assignment, and so I had one patient instead of two, and then we just started giving him every blood thinner, and then was starting to kind of stabilize a little bit. Um, but then and then my shift was over, and then 2 days later, I was gonna go back and say hey to the family, say hi to the kid, and then I found out that he passed.
Oh.
And so that like when I saw that really like took me by shock, and I had a hard time like processing that and still digesting it till this day. I thought about the family, like such an awesome family,
Yeah.
and what they must have been going through.
Mhm.
And so what I thought I had like a good coping mechanism,
Mhm.
I feel like okay, I don't think I have a good one anymore. And so I just decided to kind of take a step back from that for
Mm.
now
Yeah.
until I kind of like find a better coping mechanism, and so for me to kind of go back later. And
Yeah.
so
It's really
yeah, I think
tough.
it's a learning process.
For sure, for sure. I can't even imagine. I mean, just thinking about who I am personally, it would be hard for me to detach. But I guess you just kind of, I mean, like, do you feel like there are times that maybe as a nurse you do get like a little bit jaded, like, just oh, things happen, life happens. Has that ever
you know
happened to you?
yeah. And I talked to a lot of people, because when I was going through that, I was talking to a lot of the nurses on my unit too, and
Mm.
they're like, it's always gonna be hard.
Mm.
Some people say like over time it does get a little bit easier. As sad as it sounds, like it gets a little bit easier,
Yeah.
but I still feel like it's hard for everybody.
Yeah.
And I think it's very individual too, because dealing with the death and like especially if it's an unexpected one, like you were taking care of that patient, you were being there for them, and then now to find out, that they're gone, it
Hmm.
takes a lot to kind of digest.
Yeah, absolutely. Absolutely.
Yeah.
It's crazy. Um, David, if you don't mind me asking, and
Yeah.
I hope if you don't feel comfortable, it's fine. But I am curious to know, like, with your schedule and taking night shifts as a nurse, you are a family man, right? Uh,
Yeah.
you're married and you have an adorable little girl now, and how do you balance that? Like, is there ever any kind of internal struggle for you or any conflict as far as the scheduling that you have and being a family man? Because honestly, like as a wife and a mom, I think it would be tough for me, to like see my husband go to work every evening and kind of miss out on some of the stuff and then have to come home and like I'm sure you're exhausted, but then you still gotta do your family duties and family obligations. So could you speak on that just a little bit to anyone that maybe, like wants a family one day and also wants to be able to be a good and successful nurse?
Yeah. Um, I feel like everyone's sleep pattern is very different. So I think that's a huge part of it, you
Mm.
know? So for me, what I usually do is if I'm working like 3 days in a row, the day before, I'll just stay up all night and try to sleep that day morning so I can kind of sleep and then wake up for work.
Really?
Yeah.
Oh my
Other
gosh.
people, yeah, other people that I know, they'll just like be in a regular schedule but take like a nap in the daytime and then go to work.
Uh-huh, uh-huh.
Um, but right now, I feel like it's not too bad because like my daughter's only she just turned 6 months, but especially when she was born, like she's waking up every 2 hours, and at nighttime my wife is super tired, so I can definitely help her out at night,
Yeah, yeah,
and watch over her and like do
yeah.
like the diaper changes and everything. Um, and right now with this whole COVID thing, my wife is on distance learning.
Right. She's
On
a teacher, right? Yeah.
Yeah, and then she's on maternal leave too, so the whole night shift thing isn't a huge like controversy at this point.
Okay.
But I
Okay.
definitely feel like later when my daughter's going to school, that's when things will get a little bit more like complicated. But
For
everyone has their
now,
yeah.
it's
For
okay.
now, just yeah, just taking it one day at a time.
Okay.
Yeah,
Okay. That's good to know. That's good to know. I
yeah,
feel like it would um be stressful, but I'm glad that right now things are working out. And I guess, as your family dynamic changes, it's not like you're set in this schedule forever, right? Like possibly there I mean, oh yeah, how does that work anyways? Like
yeah.
scheduling. Do you pick your schedule?
That's a good question. So it kind of depends on the organization. So my
Okay.
first job, you have a set schedule for life, and so it doesn't change.
Okay.
So so like that was tough for me, you know. And that was 8-hour shifts too,
Oh my gosh.
but where I work now, it's 12-hour shifts, and you can kind of put in your schedule. And so essentially, it's 3 days a week. You can either like combine it, so 6 days and 6 days you're working straight, and then have like 7 days off, or you can like kind of spread it out. And
Okay.
so I think that's more comfortable for me.
That's awesome. Okay.
Yeah,
That's good to know. Well, I appreciate your time. I think we're coming to the end of our time together, but I usually ask all my guests, do you have any advice for anybody that is thinking about going into nursing or maybe even just like graduate and is like, hey, listening to this podcast, like maybe, I would enjoy nursing. Any advice for them or things that you feel like you wish you would have known before you entered? Anything like that. Any wisdom you
yeah.
have to impart.
I would say if you're interested, like ask questions to people
Mm.
that you know who are going through it because they can provide you with a lot of feedback, which I think would be beneficial. If you're kind of scared and on the fence, I would say do it. It's like an awesome profession and it's an honor to take care of people. For those who are in the process of nursing school, keep doing an awesome job. Take it day by day.
Yeah.
You're tired, it's challenging, but you can do it. And for those who just graduated and are looking for jobs, just hang in there. The time
Yeah.
will come. You'll get your spot. And so just take it day by day. That's why I like to tell everybody, like, don't stress about like the future too much. Just take it day by day and you'll get through it.
What about any advice for somebody that's a nurse right now and is just
Yeah.
feeling defeated? Like anything you would say to them to encourage them?
Oh man. I think the best thing is kind of talk it out, talk it out with your family, your friends, your work friends. You have so many resources, and I'm still learning that too, honestly.
Mm.
To use my resources. If it's like now adaptive coping, or you just burnt out, maybe pick up a different hobby, whatever it may be. I feel like everyone's situation is a little bit different, but yeah, just like talk to people. I think is the
Yeah.
most important thing.
That's awesome. Thank you, David. That's some really
Yeah,
sound advice. I really appreciate it. Hey, you guys, if you enjoyed this episode, please feel free to reach out. If you have any questions, I'm not sure if I can help you, but David, would you mind if somebody maybe if they had questions, if they had no one else to talk to, they could maybe email you and contact you?
sure.
Awesome. So you heard it right here. If you have any questions, I can hook you up with somebody that knows more information than I do. But thanks so much for listening, guys. I really appreciate it. If you have any questions, feel free to DM us or you can email us at podcastwigu@gmail.com. All right, guys, until next time. Bye.